Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Fatima, as you know, and today's lesson is unusual a little bit. I will not explain an English lesson or an English grammar, but instead of that, I will present to you one of the cases that I did present previously in my university as one of my assignments. I hope you will enjoy and it will be beneficial to you and you will learn something from it. So let's start. The case was talking about angioedema. I will talk about the definition of it, the pathophysiology, the treatment, and all of these. So, first of all, we need to summarize our case or the patient's complaints and history. So, a patient came to us. Her name is Maha. She is 21-year-old law student. She is having a swelling in her eye and in her lips. She is also have a tough voice, and she said that these symptoms occur immediately after eating an almond a magnum ice cream. These complaints are increasing. About the history, when she was a child, she has many times hay fever, and she was also allergic to milk. She is not familiar with asthma. However, the allergic eczema or the hay fever stopped when she stopped eating or drinking the milk. Okay, she is living in a dusty room and two of her brothers smoke. They do have a cat in their home. She can't exercise because of these symptoms, and she have topical corticosteroids. So let's see what are our learning objectives for today. First of all, we will define A to B, angioedema and its types. Then we will talk about the causes, risk factors, the signs and symptoms. We will then talk about the pathophysiology of this disease, the diagnosis, complications, and at the end, how to treat or prevent angioedema. So, what is A to B? And when we call a patient is atopic. A to B came from Greek word, which means out of place. Okay, what is the relation of that? Atopic patient, they have some conditions that they would be hypersensitive. They are much more sensitive to harmless environmental substance, and this hypersensitivity happen because of having genetic predisposition. So the person will have genes that will lead to this situation. He is hypersensitive to non-harmful agent like food, like medicine, and any other thing. So a patient can have hypersensitivity against or because of strawberries, other have because of peanut butters, and so on. But normal persons or normal people, they don't have this type of hypersensitivity because they eat it and it's fine, right? Okay, this type of hypersensitivity, it happens because of a special type of antibodies, and it is IgE antibody. So let's say it again. A to B describes IgE mediated hypersensitivity diseases against harmless environmental substances with genetic predisposition to develop one or more atopic diseases. So we said one or more atopic diseases. So we have many diseases that are included in A to B, right? We have angioedema, we have allergic asthma, certain food allergies, allergic rhinitis or hay fever, and also atopic dermatitis or eczema. So the patient may have angioedema with eczema or asthma with allergies to certain food, and so on. Many of them can happen, or just one of them. So what is angioedema? Our case is talking about angioedema, so let's define it. Let's know what is angioedema. Angio means vessel and edema means swelling. So angioedema means swelling because of vascular leakage. This leakage will go to the dermis or the subcutaneous tissues where they will accumulate, and that will cause the edema or the swelling. So we will have vascular leakage. We will have vessel. This vessel will be dilated, or it will be more permeable. That will lead to leakage of the substance inside the vascular, and they will accumulate in the dermis and the subcutaneous, and that will make the swelling or the edema. So we need to know that it's in the deep dermis or in the subcutaneous, not in the hypodermis. Okay, I hope it is clear. Angioedema mainly happen in the soft tissues like the lips or in the eyelid, around the eyes, and so on. There are many types of angioedema. The first one is about having allergy. The allergy will cause the angioedema. It's called allergic angioedema. It can be caused by food, by medicine, by anything that causes allergy. Milk, peanut butter, fish, any kind of medicine that you are allergic to. The other type is drug-induced angioedema. It happens because of drugs, but that you are not necessarily allergic to. So when the patient is allergic to the drug, it will be allergic angioedema. But if the drug causes these manifestation, or it causes the angioedema because of its action, then it's called drug-induced angioedema. We have also hereditary angioedema, and it's one of the rare autosomal inherited diseases. It's caused by inheriting defect genes, right? We have also idiopathic angioedema, and idio mean idiot, pathic from pathology. It means we don't know the reason that cause this angioedema, but research have found that 30 to 50% of the idiopathic angioedema cases happen because of autoimmune diseases like SLE. The other type is about having acquired angioedema, and I will talk about it later. We have also physically induced angioedema. It happened because of being exposed to excessive temperature, or because of radiation, or because of trauma, or other things like that. So let's dig in deep about the hereditary angioedema. We first of all need to know that there are 3 types of hereditary angioedema itself. The first type is about having a mutation in an important enzyme, as well as the second type. How is that? We have an important enzyme called C1 esterase inhibitor. This enzyme is important in regulation of the kinase system. Kinase system is one of the symptoms that important in regulation of blood pressure, and it has an important role in coagulation and also in inflammation. This enzyme is important to regulate this enzyme, so we won't have an hypotension, or we will not have over regulation of hypertension and so on. These enzymes are important to control this system. But this enzyme came from a gene, right? Okay, these patients with the first type, they have mutation in the genes that code this C1 esterase inhibitor. The mutation caused this decrease the transcription of this disease, so you will have less amount of that enzyme. So mutation that decrease the transcription. Then we came to the second type. The second type talk about having also mutations in the gene that code for it, but this mutation will not decrease the amount, but it will not allow having functional amount of the enzyme. So we might have normal amount of this enzyme, but they are abnormal. They are non-functioning well. Great? Okay, good. The third type is talking about having also a mutation, but this mutation will happen because of estrogen. This estrogen will have a mutation that causes upregulation of a factor called Higman factor. When we have much more of this factor, there will be increase in bradykinin generation. This bradykinin is one of the vasodilators in the kinase system, and we will see how would having much of the kinase affecting these patients. in the pathophysiology later on. So let's do it again quickly. Type 1 is about having a mutation that decrease the number of C1 esterase inhibitor. The second type is about having abnormal amount of this enzyme. They are having normal amount, but they are functionally abnormal. The third type about having mutation that cause increase in bradykinin. The other type of angioedema is acquired angioedema, and it has two types. The first one, which is about having autoimmune diseases, and this is the often happening. It's about having lymphoproliferative or autoimmune diseases that will increase the catabolism of this enzyme. The other type, which is about having auto-antibodies against it. So the antibodies will go to that enzyme and they will do proteolysis to it. Then we move to the causes of angioedema. They are similar to the types, because the types happen because of the causes, right? First of all, because of allergic reactions. They are because of the types, because of the food, or because of the medication. People are allergic to these medication, as what I said before, like antibiotics, like aspirin, like non-steroidal anti-inflammatory drugs. Patients who are allergic to these medicines or these medication can have angioedema. Also, insect bites or stings. Also, to latex, which is a type of rubber used to make medical gloves or balloons and condoms. When we go back to our case, we find out that she had previously hay fever, which is mainly caused by pollen. So anything that might be related to the pollen can cause her to have allergy. And it was the almond in the ice cream. What else? The milk in the ice cream. Good. We said also medicines, but these medicines, you are not allergic to them, but their action will make the effect, or the action that they do will make the angioedema. The NSAID, non-steroidal anti-inflammatory drugs, and they are painkillers. They might have caused that. And also ACE inhibitors. These drugs are used for people who have high pressure. These drugs are for treating hypertension. They will cause vasodilation, and the vasodilation will cause the leakage, and the leakage will cause the accumulation, and the accumulation will cause the angioedema. Also, angiotensin II receptor blockers, ARB drugs, okay? And they also are used for the same reason, for treating high blood pressure. We talked much more about that, which is having defect in the gene which is responsible for the production of C1 esterase inhibitor. The risk factors is mainly about having history before, also stress, some medication, drinking alcohol, and any allergen that will cause that. Food, insect bites or things, smoking, having some pets, dust, any other things. When you are allergic to them, they might exacerbate the condition. Okay, what are the signs and symptoms? It can be in many areas or in many sites of the body, in the head, in the throat, and it's so much important to treat the one that is in the throat, because it can affect the passage of the air to the lungs, and when there is no air, what will happen? The patient may die. Also, it can be happen in the intestine, in the GIT tract, in the bladder, in the genitals, also in the extremities, in the arms and legs. So anywhere that have dermis or subcutaneous tissues. Then we came to the pathogenesis. We have two types of pathogenesis, or two methods that this disease can be caused because of. The first one, which is about hereditary angioedema, and it's about having C1 esterase inhibitor that is not functioning well, or its amount is reduced, and that will increase the number of bradykinin, which will cause vasodilation, and it will cause the same effect of inflammation. There will be leakage and accumulation, and that will lead to angioedema. So this is about the kinin system. The C1 esterase inhibitor is defected, or it's in a low amount, will increase the bradykinin, which is vasodilator, and the angioedema will happen. The second method is because of allergic responses. It is like any kind of A to B, which is related to the IgE antibodies. In the first exposure, the macrophage will intake the allergen. These allergen will be preceded, and they will be presented by the major histocompatibility type 1. This macrophage will present it to the T helper cell. The cell will activate B cells. B cells will become plasma cells that will produce the IgE antibodies. So this kind of antibody will bind to the mast cell on its receptor, which is Fc epsilon Ri receptor. This is the name of the receptor. So now the antibody is attached to the mast cell on her receptor. The antigen in the next time will come and bind to that antibody. This will make the mast cell degranulate. It will release histamine and other inflammatory mediators. Histamine will cause edema, as we know. Okay? Histamine will do vasodilation. There will be increase in the vascular permeability. There will be leakage, and edema will happen. Then angioedema is occurred. I hope you got it. So, how to diagnose angioedema? There must be clinical evaluation, dermatologic evaluation. Also, we need to check the GIT and also the upper respiratory tract. We need to take the history, of course, and we will need to do skin prick test to know the causative allergen. When we put the allergen on the skin, the positive test will be that the skin is red and itchy, as what we said here. And we can do also blood tests to see the amount of the enzymes that we talked about, like esterase, C1 esterase inhibitor, and also the amount of bradykinin in the blood. Differential diagnosis of this case can be asthma, eczema, pollen allergy, or allergic angioedema, which is the case in here, right? Okay, how to treat angioedema? Most of the cases, they are self-limited. They will go by themselves. But if the case is severe and it involves the respiratory tract, we must make it the first priority. We need to make it the first priority, and we need to secure the airway. But if it's severe and it has persistent swelling, it has itching and pain, and it's not for a short period, we can give them adrenaline, corticosteroids, or antihistamines. The complications can be having dysphagia, respiratory distress, or in the worst cases, death. So to summarize, angioedema is a type of type 1 hypersensitivity, which is caused by IgE mediated type of hypersensitivity diseases. It's caused by allergic reactions, medicine, genetic factors. It can be acquired, allergic, or hereditary. The symptoms mainly will be swelling in the lips and also the tongue and the eyes. People with angioedema can develop many complications such as complete airway obstruction or respiratory distress. The treatment will involve antihistamine drugs and the avoidance of the allergens if it exists. These are my references. Keep calm, study hard, and become a doctor.